If you've just gone through an embryo transfer, I know the only question running through your mind is, am I pregnant? The 2-week wait after IVF is one of the hardest times for every patient. Your mind is constantly searching for signs. Every cramp, every twinge, every bit of breast tenderness makes you wonder if it's a pregnancy symptom. But here's the truth: the medicines we use in IVF, progesterone, estrogen, even the hCG trigger, can mimic pregnancy symptoms, which means your body cannot give you reliable answers. That's why I tell all my patients symptoms don't confirm pregnancy, only a blood test does. The gold standard is the beta hCG test done 12 to 14 days after embryo transfer. But I also understand waiting that long can feel unbearable. Many patients turn to Google or do early urine tests only to get more confused and anxious. This is exactly why I created a free AI tool for you, hCG AI, at hcgai.com. Here's how it works. Do your blood beta hCG test at your local lab. Enter your results into hCG AI. The tool will instantly interpret whether your hCG values are rising appropriately and whether they match the trend we expect in a healthy pregnancy. Instead of sleepless nights of guesswork, you'll have data-driven clarity right at your fingertips. This doesn't replace your doctor, but it empowers you. You don't need to feel lost or helpless. You'll know whether your pregnancy is progressing normally, and you'll be able to ask your doctor better questions at your next appointment. So if you've just had an embryo transfer, here's my advice: wait at least 12 to 14 days. Do a blood beta hCG test. Enter your numbers at www.hcgi.com. Knowledge is power, and with the right tools, you can take charge of your own IVF journey. If you'd like personal guidance, you can also book an online consultation with me at drmalpani.com. But in the meantime, don't let anxiety take over. Use the tool, understand your results, and take control. I'm Dr. Aniruddha Malpani. Thank you for watching, and I wish you clarity, confidence, and most importantly, a healthy pregnancy.